We do have an email question that comes to us this evening. I have some food-related questions this viewer asks. Does milk really make teeth healthier, or is that a wives' tale? And also, my mother tells me that when my son eats an orange, he shouldn't suck on the sections with the peel still on, which he loves to do, because the acid is bad for his teeth. What do you think?
There are lots of tales out there about different foods, and some good information, some not so good information. But I think I'm glad that the viewer has pointed to issues related to food, because that's, I think, one of the main factors in terms of getting us a good start, a good healthy start toward good oral health. What we know in terms of foods that are particularly harmful are those that either contain sugar or types of sugars, but also even starchy snacks like potato chips, crackers, goldfish, things that we love to grab when we're on the go and when we're wanting a snack. And it's those sugars and those starches that really begin the process of tooth decay. Tooth decay happens when bacteria feed on those same products that we love to feed on. And the bacteria turn those sugars into acid that they produce. Especially if the food is sticky, chewy, sticks to our teeth, is cleared, it takes longer to clear from our mouth, that acid attack lasts longer, okay? And so it's also the frequency at which we nibble and snack on those kinds of things. Milk certainly is beneficial to us in terms of giving us calcium and other minerals, vitamin D. So I wouldn't ever discourage folks from drinking milk. We need it. But even milk used in a harmful way can lead to tooth decay. What we see when we see that most often is children who take a bottle of milk to bed with them at night, and that last little bit of milk sits around the teeth for hours on end. Milk contains sugars as well, so it can just be just as harmful if we use it in the wrong way. So it's really about trying to make good, healthy choices. I wouldn't be concerned about an orange. I don't think that's going to cause a problem, but I'd be more concerned about the pack of Oreos or the pack of the bag of potato chips that we take with us and nibble on in the car on the way to soccer practice, things like that.
Two other food-related facts. One, thinking about the question about the orange, is sucking on lemons. I've certainly seen people who have a real habit of sucking on lemons, and the acid in the lemon is very acidic. So that's not a good habit for people to have. Also, Dr. Venisi mentioned juices as having natural sugars, and a lot of times you'll see young mothers who are trying to do the right thing with their children, and they'll give them a sippy cup with apple juice and let them walk around all day sipping on the sippy cup, and that can really cause tremendous damage. There's enough sugar in the apple juice when you have that repeated frequency, as Dr. Venisi was talking about, that can cause some real problems.
And one of the things, the question about oranges, as Dr. Venisi said, certainly habits in which lots of fruits and vegetables are part of the diet is very critical to providing patients good dietary habits, as well as it stimulates the saliva and therefore the cleansing for the teeth. That the natural process from saliva is going to improve the overall health of the teeth by reducing the amount of plaque on the teeth, as well as providing the opportunity for us to remineralize through the saliva. The minerals that is in saliva will remineralize teeth as they're bathed in the saliva.
All right. And kind of jumping off of that too, chewing sugarless gum, I've read that can help in between meals or snacks if you don't have an opportunity to brush. Is that true?
It definitely is. As Dr. Hollowell was pointing out, the sugars and products that cause tooth decay need to be cleared from our mouth, and saliva is the way that we clear those products from the teeth. And chewing sugarless gum stimulates saliva flow and can certainly help at those times, maybe in the middle of the day when we don't have an opportunity to brush. Certainly a good idea.
And some of the recent products include xylitol as one of the sugars that gives us a very positive and enjoyable flavor for the products. But the studies have shown that the xylitol has an effect on the bacteria that will reduce some of the karyogenic bacteria and therefore create an environment that is much more healthy in the mouth for those people, both in the interim between being able to brush as well as to follow after that time throughout the course of their life. Just change the bacteria.
And the xylitol is really good. I mean, the studies are starting to show that. One challenge, and it is sugarless, so you're not getting the sugar in the gums. It is a bit of a challenge to really get the therapeutic effects. Is you have to chew pretty much for a pretty long time. So that's something I think we'll be learning more about as time goes on. But I think it's a product we need to watch.